We have a new face joining us Mondays at 7:15 on our On Call segment. Dr. Mallika is a practicing physician and Emmy Award-winning journalist at her sister station, CBS Boston. We'll hear from her every week to cover the important health topics that matter to you. Today, she spoke with Chris Raggi about fluoride, why it's in our water, and what it does for our health.
Last week, Health and Human Services Secretary Robert F. Kennedy Jr. called for the end of fluoride in water. Now, this has sparked debate and questions about whether fluoride is good or bad for you and if it should even be in our water supply. Dr. Mallika is on call with us to help break all of this down. Doc, good to have you with us here. What exactly is fluoride and how beneficial is it to us?
Okay, so Chris, fluoride, it's a mineral that occurs naturally in many foods and water. And you know, for years, dentists and healthcare providers have been promoting the use of fluoride to help strengthen teeth and reduce the risk of cavities. That's because it makes your tooth enamel more resistant to acid and can also help reverse early decay. Now, most toothpaste and mouthwashes contain fluoride, or you can get a fluoride treatment from your dentist where they apply it directly to your teeth. I remember as a little kid having those trays with the gel in it, but now I think they can paint it on.
And of course, we always see it on toothpaste. So, when was it common? When was it a common practice, I guess, to add fluoride to public water supplies?
Many, many years ago. You know, dental decay, cavities, and dental infections were incredibly common, and a lot of children were actually losing their teeth. So they looked and they found that areas where fluoride occurred naturally in water, that people had less tooth decay. So then they started adding it to the public water supply, and levels of tooth decay fell dramatically. So much so that the CDC actually declared water fluoridation one of the 20th century's greatest public health achievements.
So I guess that leads people to ask why changes. Some reports say, though, high levels of fluoride causes health concerns, including possibly lower IQ. Is there any truth to that?
Well, certainly at very high doses, it can cause side effects. One of the more common ones is for people who ingest too much of it, they can get tooth discoloration, they can get spots on their teeth. And as you mentioned, there has been some concern that high levels of fluoride may be associated with lower IQ scores in children, but this has not been well established and more research needs to be done in this area. And at the levels that you would actually find in public water supplies or over-the-counter dental hygiene products, it's highly unlikely that you would reach levels that would cause any of these kinds of problems.
So the state of Utah recently became the first state to ban fluoride in their water, and now some areas are talking about removing fluoride as well. Have we heard of any early results, and why would you, I guess, see this as being a bigger problem if other states adopt this?
That's right. So we actually talked about the benefits of fluoride and the risks of tooth decay. And there are many people actually in this country who don't have access to routine dental care or brush regularly with fluoride toothpaste, especially people who live in rural or low-income areas. I also take care of a lot of immigrants in urgent care who come from places that don't have fluoride in their water supply. And I've seen so many young kids with terrible cavities, even among their front teeth. So tooth and gum disease can be painful. It can affect your ability to speak, eat, sleep. It can alter your appearance so that it can impact someone's self-esteem. And listen, we're not just talking about bad teeth, but tooth decay and gum disease are now being linked to heart disease and other chronic illnesses. So it's not just about having a pretty smile, it's actually about our overall health.
It is definitely a cascading effect. Thank you for the insight, Dr. Mallika. We greatly appreciate it. But you know what? Before we let you go, while you're new here to this audience at 7 a.m., longtime CBS viewers will recognize you from years ago. I want to take a look at this quick segment here with you working with another star of CBS. This morning in our series, Early Keeps the Beat, a look at how your mood and your emotions affect your heart. Dr. Mallika Marshall is here with the latest findings. Good to see you as always.
As always.
So if I'm in a bad mood, I'm thinking it probably comes from here, but it actually affects what's in here.
It sure does. I mean, we know that there is a mind-body connection.
A little blast from the past, and it's awesome to be working with you again, Doc. It's really, really good to see you. We were much younger then, but we don't look it. But that was all the way back in 2008, so that was more than a cup of coffee.
We look the same. Oh my gosh. Chris, I've missed you, and I'm so glad to be back with you.
I haven't aged a bit, and it's great to see you as well. And Dr. Mallika will be on call every Monday at 7:15 right here on CBS News New York.
Pope Francis